Welcome back to nursing practice or nursing education. So the following is my answers. These are my answers for this reflective questionnaire on the topic of code of conduct. And this is it's called the CNO Practice Standard Code of Conduct. So the first question was, what are the key principles? And the answer for that is found on page 4. That's the answer. Just copy paste. And then number 2 is how is your conduct inconsistent? And I'm going to refer to principle 2.3, which is self-reflection. Ask feedback from the healthcare team. I didn't ask any feedback. Number 2.10, I was not aware of the client's personal health goals. The client, put that in brackets. And so I need to tailor care and care plan in light of those goals and to help the client achieve those goals depending on whether they are realistic, achievable, and measurable. 4.6, I should have collaborated with other healthcare team members to provide the client care. 5.6, personal gain was to practice, and it may not be applicable, so I may not include this at all. 6.3 is to take accountability for not including other members of the team, the healthcare team, to assist me, and be a witness, second or third witness, so even 2 people. In case of a situation that requires a second or third eyewitness. Okay. So how is my conduct inconsistent? I just addressed that. So what are examples of how these principles can be applied to my practice? Okay. So if I look them over once again, how can I apply them to my practice? So let's go to the top. So how can I maintain dignity for clients? Well, if I look at the umbrella statement, is to remember to treat them with respect, empathy, and compassion. It has to be the foundation of care. To respect their preferences. So when I look at geriatric settings, that's one of the most important aspects. Can be one of them. It's the top 10 for sure. Because when a client who has dementia, for example, dignity is easy to neglect. Can be neglected very easily, but it's important to put yourself in their shoes, because when the day comes and I'm in their position, I would want to be treated with dignity as well. So that's my answer for that one. Point 2, provide inclusive, culturally safe care. So this can be applied because what I'm noticing in a lot of nursing homes there are clients who don't even speak English. There are clients who have different religions and different dietary preferences, or even the way you provide care, whether they want a woman only or a male only. You have to respect that, and that's being inclusive and culturally safe by respecting what their cultural practices and perspectives are. In terms of 3, provide safe and competent care. How can that? Well, safety is of prime importance for seniors, especially when it comes to falls, preventing falls. So that needs to be maintained by always, for example, when you get the lifter or someone's using a lifter, they must have a second person to not only supervise but help if necessary. One person should not be operating a lift, like a Hoyer lift, for example. Number 4.4, work respectfully with other team members. How can that be done to meet the client's needs? Well, let me scroll down and look at point 4 because that's important in terms of nursing homes. How can that be addressed? So I think it's a similar situation to the client, because we have team members from different cultural backgrounds, religious backgrounds, and different opinions, whether it's politics, whatever it is. We need to respect our team members the same way, because if we respect each other as fellow team members, only then can we deliver the best care. Now, it sounds like an umbrella statement, I know. But when you foster respect, respect has to be earned, right? It's not something everyone's respectful for no reason. You actually, you build a relationship with your team in terms of, respect and knowing how everybody works. If somebody is strong in one area, one is more knowledgeable in another area, or if we know that, this is a good example that I'm about to say, is if there's a client who favors one of the healthcare team members, and that there's another member of the healthcare team that triggers them, that makes them angry, then not that you'll never get them to work together, but you want to maybe introduce that person that makes them angry by the person that they get along with, and you sort of try to streamline the work so that in case of their absence, they can develop that trust and see, this was a misunderstanding. That's why there's this conflict, and now there's no longer a conflict. So that can be a way to address that. Okay, number 5. Act with integrity in the client's best interest. Okay, this one's a little vague. So how do we act with integrity for the client? So maintain confidentiality. So a lot of times I notice staff will talk about a client during their break and even say their names. And we have to be very aware of not doing that. Doing so only, actually, I don't think it should be done at all in the break room to talk about clients. We should just keep that out of our habits. But another thing is we must be aware of the environment we're in. So don't talk about clients in front of family members. It's not respectful. That's not a good way to act with integrity. So integrity means to not just do something when no one's watching, or I should say when everyone's watching, but especially when nobody's watching. So that's important. So to be as much as we can consistent with who we are in public, in private, alone with a client. I shouldn't say alone with a client, but at all times to be a person of integrity. Number 6, the last one, maintain public confidence. Okay, so how can we talk about this one? How can I apply this to the nursing home, geriatrics? So just to be disciplined. One way to so this one's a little nebulous. Actually, maybe it's the first few points. Okay, understand compliance. Okay. Okay, so how can this be applied? Okay, advocate for improving quality of their practice. So one thing we can do, okay. So how can this, number 6 is a tricky one. I'm going to say 0.5 is probably easily applicable in a nursing home setting. Participate and advocate for improving the quality of their practice, a nurse's practice setting, to support safe client care. So I think when we do a risk hazard assessment, when we look at, sometimes we'll have a committee that is on like identifying hazards, and then we would suggest to the healthcare team what are possible alternatives to improving the quality of the care setting, even the environment, and even the way things are done to improve client care, make sure it's safe. For example, if there's like something in the room that is a hazard, for example, let's just say a call bell that is not working properly, or you notice that there's malfunctioning equipment, something like that needs to be not only fixed but even improved. So we're not just sticking with the status quo, but we're trying to go beyond what is the status quo in order to improve not only our ability of ourselves to practice, but even the standards of the home as a whole. Okay, so that's how it can be applied. So using these principles, outline strategies for how my misconduct that I identified will not occur in the future. Okay, so I did look at a couple areas, or 3 areas in particular. So 2.3, so how can I ensure this will not repeat? So ask feedback from the healthcare team. So one way is to be more assertive in my approach, I tend to be an introvert, so don't be introverted, and be more collaborative with other healthcare team members. So that would help if I work there more. So to develop a relationship with a professional relationship with other team members, collaborative relationship, professional. So being aware of the client's healthcare goals, how can I be aware of those? Taking the time to read their care plan, to talk to their, let's say their POA, and involve other healthcare team members to come up with strategies. How can we identify the goals and then work towards doing that? Okay. Number 4.6, how should I have collaborated with them? Again, this relates to asking. The first 2.3 is actually feedback. So asking feedback, it means being able to be humble enough to ask for constructive criticism. So actually that was 2.3. 4.6 was what I said for 2.3. And then 6.3, the accountability for not including other members of the healthcare team to assist me. So how that can be prevented is simply understanding that I'm not the only person there in the building. There are people that do care, and you have to make allowance for them to help you. You have to understand putting yourself in a situation alone with a client is very unwise. So that should not be repeated by putting myself in a situation that requires other people to be there as witnesses. I think that is important. Okay, so I think that's all for that. The answer is there, so I'm going to stop the video, and I can always transcribe that. That's 14 minutes. It's a long question. I have to take up a big page.